Good morning, I'm Joe Fryer.
And I'm Savannah Sellers. Right now on Morning News Now, roll up your sleeves. It's official this morning. Top health officials now advising that vaccinated Americans 18 and older will be eligible for a COVID booster shot in the coming weeks. Available 8 months after your second jab, as new research points to an efficacy drop in the vaccine over time. Meanwhile, President Biden is threatening possible legal action against GOP governors who are blocking mask mandates in schools. We'll bring you the latest from the hard-hit South. Left behind, a stunning headline out of Afghanistan on this Thursday morning. The Pentagon announcing it does not have the capability to rescue Americans stuck in the embattled country who cannot make it to Kabul's airport. We're on the ground with the latest developments as the president sets a new deadline to pull troops out of the country. Plus, the president now speaking out on the militant group's lightning-fast rise to power in a new interview. Facing discrimination, a shocking new report on America's trans community out this week finds nearly half have been mistreated by medical providers while seeking necessary care. We'll dig into those troubling numbers and introduce you to the people who are fighting back. And daycare chaos. Pandemic supply and demand has hit the childcare industry hard as a shortage of labor and seemingly endless waiting lists have driven the costs for some American families sky high. We'll take a closer look at this growing problem with no easy solution in sight. One thing the pandemic has shown us is how parents and child care caretakers are heroes.
Absolutely, without a doubt.
Yeah, oh my goodness, I can't imagine. But let's get started this morning with those booster shots. More than 150 million Americans who've already received 2 doses of the COVID vaccine are now being told to roll up their sleeves again.
The Biden administration announced that Americans who got the Pfizer or Moderna vaccine will have to go back for another shot 8 months after their second dose. Right now, only people who are immunocompromised can get a booster, but about a month from now, starting September 20th, all Americans will be able to get their third shot. The president, citing recent studies that say protection against infection is waning, says boosters will help the country fight the dangerous Delta variant.
Now, this will boost your immune response. It will increase your protection from COVID-19. It will make you safer and for longer. And it will help us end the pandemic faster.
President Biden is also ordering his education department to take action against governors who are blocking mask mandates in schools. Some states like Florida are threatening to withhold school officials' pay if they enact mandates. And the Biden administration says it's prepared to pay school boards that lose salaries because of this. The push to mask up in schools comes as cases rise nationwide, especially among younger kids who are not yet eligible for the vaccine. NBC News correspondent Ellison Barber is outside a children's hospital in Mississippi that is seeing a rise in COVID patients. And NBC News medical contributor Dr. Kavita Patel is answering our questions on booster shots. Let's start with Ellison in Jackson. Ellison, I know doctors where you are have actually opened a field hospital. That's how bad things have gotten. What are you hearing from doctors there?
Yeah, so, Joe, this is the second field hospital they've had to open at the University of Mississippi Medical Center. You can see behind me, it is literally in a parking garage to get to the tents where there are ICU beds and step-down beds, the step below ICU, all of it for COVID patients, but it's just past literally the tables, if you will, the turnstiles that you go through when you are parking in a parking garage. This is the second field hospital they have had to put on this hospital's campus. Samaritan's Purse has funded this one. They are running this one. They tell me the last time they had to do something like this in the United States for COVID-19 was January. 8 months later, 3 widely available vaccines later, and this is where things are. Listen to more of what they told us. Were you expecting to need something like this summer?
No.
Is it disappointing?
A little bit, but, honestly, right now, Samaritan's Purse is doing this, and we're rushing a field hospital down to Haiti after the earthquake. So we exist to serve, really, I mean, it might be disappointing that we have to do it again and again when it's avoidable, but people in need, and that's where we go,
This This hospital system, the University of Mississippi Medical Center, is the state's premier hospital system. They are the only level 1 trauma hospital in this state, and they are struggling to keep up with the surge of COVID patients. This field hospital, their other one as well, it is only for adults who have COVID-19. But right over here, you can see is their children's hospital. And Joe, they are struggling to keep up with the surge of children coming in because of COVID-19. Joe?
Yeah, Allison, along those lines, I know you spoke with the parents of an 11-year-old boy in that hospital with COVID right now. How is he doing? What did his parents tell you about their situation?
Yeah, he was admitted to the hospital on Monday, 11 years old. His name is Donovan. He has asthma, so his parents say they kept him home most of the summer because they were worried about the numbers, the increases, the things they were hearing in this state. He turns 12 next month, and they were planning to get him vaccinated as soon as he turned 12. He started school just the other week. They believe he contracted COVID-19 at school or on the school bus. He was wearing a mask, but at his school, like most in Mississippi, masks were optional for everyone. Listen to more of what they told us.
We didn't expect it to happen to our son. By him, we try to keep him in all summer, but when we let him go to school, that's when he contracted COVID-19. Them not being safe and protecting our kids.
And I'm being honest, I can be, I would never thought it would got to my son, but he is human. He's like anybody else that's on this earth is human. And it could happen to your child, to you, to anyone.
One of the pediatricians we spoke to said that the number of COVID pediatric cases they're seeing right now is astounding. And she said right now it's not just people being admitted because of COVID-19 in their pediatric wards, but they're also starting to see an uptick for that rare inflammatory virus that comes after MIS-C. And they're really worried about that because, Joe, typically they say they start to see that about 4 to 6 weeks after a peak in the community. And they're seeing increases in that right now. Joe?
So, Ellison, kids like Donovan can't get the vaccine yet, but pretty much anyone older than him can. How are vaccinations going right now in Mississippi? Is the state doing anything to try and boost their numbers?
I mean, health officials here have really tried to be brutally honest with residents. People at this hospital, leaders in the health community, have tried to make it very clear about what they're dealing with and their disappointment that more people in Mississippi have not gotten vaccinated. The vaccination rate here is less than 40%. And despite calls from health officials, the American Academy of Pediatrics, their chapter in this state, the governor has been adamant that he will not do any sort of mask mandate in schools. There have been over 80 outbreaks in schools on top of the surge we were already seeing here. And health officials really, they're seeing numbers pick up in vaccination rates, but they also feel like things are lagging here in terms of masking, and those numbers really just aren't moving fast enough. Joe?
Begs the question, how is this going to end? All right, Ellison, thank you for your reporting as always.
Let's now bring in NBC News medical contributor Dr. Kavita Patel. Dr. Patel, always great to have you with us. So I, of course, want to talk booster shots this morning. But first, let's start there with what we just saw. Young Donovan, not eligible yet for the vaccine. So does keeping kids like him protected and prevent more kids from being in the hospital come down to the adults around them getting vaccinated and those kids wearing masks? I mean, what needs to happen, especially as kids under 12 not eligible for the vaccine return to school?
Yeah, Savannah, you said it exactly right. Adults, anybody actually 12 and above that can be vaccinated, should be vaccinated. And then even on top of that, Savannah, I think what's interesting is that we're seeing now cases going up even in my kind of home state area of Maryland and the D.C. area. And that's not just because we have nobody, people that are not vaccinated. We just have a lot of virus circulating. So vaccines plus masks when indoors, on children and on the adults who are interacting with those children, because both can transmit to each other when you have that level of viral activity in a community.
Now let's talk about those booster shots. So for Americans who got the Pfizer or Moderna shot, a third dose is recommended, and it's recommended 8 months from the time that you had your second dose. First, let's listen to what Dr. Anthony Fauci told Lester Holt about our immune response to a booster shot.
Because of the data we have now, of when we've done studies with boosters, the level of antibody that has been elevated by that third shot is extraordinary. It goes up at least 10, sometimes 20 or more fold.
So at this point, is the COVID vaccine on its way there to becoming an annual vaccine? I mean, like the flu shot? And put this in context for us. And what does this mean after you get a third shot?
Yeah, it does look like we're going to some sort of regular COVID vaccine, whether it's annually or every other year, Savannah, will largely depend on what these variants look like. We get a yearly flu shot, that's some context for you, because of the way the flu virus changes, and we have to tailor that vaccine. It does appear that COVID could take that pathway. And I also think, just for context, Savannah, boosters are not new. We get boosters as adults for many of our own vaccines, and of course children get boosters. So things like tetanus shots and diphtheria. So this, to me, just indicates that the coronavirus is never going to be eliminated, and that it's going to fall into some of the other viruses that we've kind of gotten used to, but have not seen to this level with the coronavirus.
Now, Dr. Patel, you probably know what my last question is going to be, and it's about those of us who got the Johnson & Johnson vaccine. Unfortunately for you, because I have your phone number, you are very aware of this and the many questions that I have had since I received that vaccine. But I mean, we were told the shot that you should get is the first shot that's available to you. For 14 million Americans, that was J&J, and there's no guidance for us here. What does that mean is next?
Yeah, Savannah, there's no way to put this except you just feel like you're searching in the dark, and it's disappointing. But here are two pathways that are likely. A couple of things to help you feel at least some comfort. Most people receive Johnson & Johnson starting in March or later. It was authorized February 27th. So you fast forward March to 8 months. We're looking at least November. Between now and then, Savannah, there are two pathways most likely to occur. Johnson & Johnson has been working on a second dose, a booster of sorts, for their own vaccine. So you might get a second dose of Johnson & Johnson recommendations soon. And there's also been some what we call mix and match studies, Savannah. It could be that one dose Johnson & Johnson, one dose of a Pfizer or Moderna, it could be incredible immunity. That data should be coming soon in the next several weeks.
All right, Dr. Kavita Patel, thank you as always. Good to see you.
Take care.
More desperate scenes are emerging this morning outside Kabul airport in Afghanistan as hundreds of Afghans scramble to flee the country. The Taliban is reportedly refusing entry to those without documents and urging people to stay away from the airport. 12 people have been killed since Sunday, according to both the militant group and NATO officials. The White House says it has evacuated about 6,000 people from Afghanistan so far, but many thousands more still remain. This as other countries also frantically pulled their civilians out. U.S. Defense Secretary Lloyd Austin says the U.S. is working with the Taliban to get Americans out, but warned the U.S. would not be able to expand the rescue mission beyond the airport.
We don't have the capability to go out and collect up large numbers of people. Well, we're going to do everything we can to continue to try to deconflict and create passageways for them to get to the airfield. I don't have the capability to go out and extend operations currently into Kabul.
For more on this unfolding situation, we're joined now by Ali Arouzi in Tehran and Matt Bradley in London. Good morning to both of you. Ali, while it does look like foreign nationals are being allowed into the airport, many Afghans are trying to flee. They're facing a desperate struggle to try and get there. What is the situation like today?
That's right, Joe. The evacuation of foreign nationals continues to pick up pace. The military side of the airport is more in control than it has been over the last few days. And with the U.S. military footprint expanding on the ground, they're able to get more and more people onto military flights out of Kabul. But for Afghans trying to flee, it's a whole other story. There have been a lot of upsetting images I've been watching of Afghans crowded outside the airport, amongst them women, children, elderly and disabled, with whatever belongings they can carry, trying to see if they can get into the airport and out of Afghanistan. But the perimeter is swarming with Taliban fighters that are whipping them back and screaming at them. Others are being turned away by U.S. and British troops because they don't have the right paperwork, only to face a Taliban checkpoint on the way out. So it's a dire situation on the ground there.
So, Matt, despite that, we saw the first anti-Taliban protests yesterday in Afghanistan since the militant group took over. They were met with a violent response from the Taliban. Tell us more about what happened, and could we see more demonstrations? Just how strong is the dissent there?
Well, it wasn't exactly the first, Joe. I mean, there was a group of women in Kabul who had been holding up signs a couple of days ago, shortly after the Taliban took over. But this is the first real protest that we've seen. And it was timed for Afghan independence back in 1919, celebrating Afghanistan's freedom from the British. And now it seems as though they're bracing that national flag, trying to say that this is the flag, not the Taliban flag. They were violently dispersed. This was in Jalalabad in the northeast of the country and a couple of other places, a couple other cities in eastern Afghanistan. But really, whether or not this is sustained, well, that's up to the people and up to the Taliban. The fact is that this flag waving ceremony was essentially because of that Independence Day celebration. So do they need an occasion in order to protest? That's another question. I mean, coming up, it's going to be hard to know whether or not the public is going to be willing to go out and show their faces again. But, you know, this suppression, it might not have been as violent as many Afghans had suspected. It still seems as though, despite what we saw in the streets of Jalalabad and some other places, that if anything, the Taliban is showing some level of restraint. Guys?
Ali, I want to ask you about the former president who fled the country, Ashraf Ghani. He's now in the United Arab Emirates. He spoke for the first time since leaving. Why did he say he left?
That's right. The UAE's foreign minister said that they welcome Ghani and his family on humanitarian grounds. And in a video address last night, Ashraf Ghani denied fleeing and said he had to leave to prevent what he described as a huge disaster. He said that for the time being, he would remain in the Emirates so bloodshed and chaos would stop, and that Kabul should not be turned into Yemen or Syria over power struggles. And that's why he was forced to leave. But he said he supports talks between the Taliban and top former government officials, and that he was in talks currently to return home. But he's come under intense criticism from other Afghan politicians for leaving the country, especially as his vice president, Amrullah Saleh, has joined forces with Ahmad Massoud, the son of the former famed anti-Taliban fighter Ahmad Shah Massoud, in the Panjshir Valley. And that's the only region not controlled by the Taliban. Ghani was also tried to push back on rumors that he left the country with tens of millions of dollars. He said he only fled with a waistcoat and some clothes.
Matt, in the wake of all this, the IMF is now joining the European Union in suspending development aid for Afghanistan, money to help them rebuild. What does this mean for Afghans? And is the country facing a humanitarian crisis right now?
Well, the country is facing a humanitarian crisis. The World Food Program and others have warned that starvation could be imminent. But we have to remember, guys, that this was inevitable. The IMF, the World Bank, other international institutions, they were never going to be financing the Taliban. But, you know, as of last week, this national government that before the Taliban took over, it was running on about a $5 billion a year budget. More than half of that came from international aid. Without that, they're going to be relying on the Taliban and their expansive drug dealing operation, probably, for financing. Guys?
All right, Ali and Matt, thank you so much for your reporting. Appreciate it.
Now, President Biden is still standing by his decision to withdraw U.S. troops. But as we just heard, this comes as top Pentagon officials admit Americans are largely on their own to get to the Kabul airport safely. NBC News correspondent Josh Letterman is at the White House this morning. Josh, good morning. So, I mean, let's, of course, start right there and with the Pentagon's assessment on getting Americans and allies out of Afghanistan. What are the latest numbers? What is their strategy moving forward? And if you are an American not at the Kabul airport but in Afghanistan, what are your options?
Yeah, well, let's start with the numbers, Savannah. 1,800 individuals who have been evacuated in the most recent 24-hour period, according to the White House. So that brings to the total since August 14th to 6,000 individuals who have been evacuated. That's a mix, of course, of American citizens as well as some of the Afghan allies that we're starting to get out of Afghanistan. As far as what to do if you're stuck in Kabul somewhere else, you know, the advice from the military is really to try to make your way safely to the airport. at the time when the State Department reaches out and says there's a flight for you. But that's clearly the big mess here right now is how do you get to the airport safely when you have all of these Taliban checkpoints? And we heard from Defense Secretary Lloyd Austin, who said they're still clearly in the ramp-up phase of this evacuation effort. Take a listen.
We're really working hard to get as many people through as possible. And quite frankly, it's obvious we're not close to where we want to be in terms of getting the numbers through. So we're going to work that 24 hours a day, 7 days a week. And we're going to get everyone that we can possibly evacuate it. And I'll do that as long as we possibly can until the clock runs out or we run out of capability.
Within a few days, they hope to be able to get up to 5,000 people a day. They can get out of the country or even more, Savannah. But in the meantime, you know, this effort is largely at the whim, frankly, of the Taliban to actually allow people to get to the airport for safe evacuation.
And now, Josh, we have heard from President Biden in an interview with ABC News, and he addressed this urgency to evacuate people on the ground and the timeline for making it happen. And he also gave a specific date for when the U.S. will now fully be out of the country, again, removing those troops. What's he saying about that, and what does that mean for our Afghan allies?
Well, the president's saying he hopes to be able to get all of these folks out by the end of the month. He's equivocating a little bit about what that would mean in terms of U.S. troops potentially staying even longer if the task is not done yet. But the president emphasizing in this new interview that one way or another, our exit from Afghanistan was going to be a little bit messy. Here's what he said.
How about our Afghan allies? We have about 80,000 people.
Well, that's not the estimate.
Is that too high?
That's too high.
How many?
The estimate we're giving is somewhere between 50 and 65,000 folks total, counting their families.
Does the commitment hold for them as well?
The commitment holds to get everyone out that, in fact, we can get out and everyone that should come out. And that's the objective. That's what we're doing now. That's the path we're on, and I think we'll get there.
So Americans should understand that troops might have to be there beyond August 31st.
No, Americans should understand that we're going to try to get it done before August 31st.
The president clearly does not want to keep troops there any longer than they have to be, given the dire security situation and the lingering questions about how long the Taliban will allow the U.S. to continue to be in the country to try to do this evacuation without facing attacks from Taliban forces.
All right, Josh Letterman, thank you so much.
Thousands of California residents are scrambling to get to safety as the Caldor fire burns out of control in El Dorado County. That's just east of Sacramento.
NBC News correspondent Jake Ward is on the ground with the latest.
Good morning, Joe. Good morning, Savannah. The Caldor fire began over the weekend and grew exponentially, behaving in ways that Cal Fire says was unprecedented. The Caldor fire just outside Sacramento exploded, doubling in size.
This area is extremely hard for us to get into.
In California, some 31,000 residents are under evacuation orders. At least 2 civilians were injured in the fire, which remains entirely uncontained.
We are seeing generational destruction of forests because of what these fires are doing. This is going to take a long time to come back from.
Gusty winds and dry drought conditions creating a dangerous situation, destroying numerous homes and property. This classroom used to belong to the elementary school students here in this small town. It's a reminder that wildfires don't just touch down in remote areas. Increasingly, they are sweeping through our lives. Residents racing to get out and making their way to safety.
It's just it's sad what's happening. It's hurting my heart right now because as I'm driving up here right now, if this is the last time I ever see this area, it'll be heartbreaking for me.
These satellite images from NASA show the dark smoke reaching all the way to Nevada, where ash rained down. Officials here are saying that fire conditions continue to be very scary. That's because we have record dry fuel on the ground, drought, and high wind conditions. All of that means that fires that might have just been a small thing a few years ago swept through this kind of community in a very scary way. Joe, Savannah?
All right, Jake, thank you so much.
It's definitely a busy weather day, really a busy weather week. We're tracking the latest on Tropical Storm Henri, as well as Fred and Grace.
That means Bill Cairns is here with the latest. Hey, Bill, good morning.
Yeah, good morning, guys. And the big headline this morning is that there's still a chance that New England gets hit by its first hurricane in 30 years on Sunday. So that's like an eye-opener, like, wait, I can't believe it's been 30 years. It's been hit by tropical storms, but it's been 30 years since Hurricane Bob made landfall in New England. So let's first talk about the immediate, what's going on with Fred. We did have some tornado warnings overnight in areas of New Jersey. We still have some very heavy rain and some flash flooding issues in central New York. And now the worst of the morning commute drive is from Hartford heading towards Boston with some areas of heavy rain. The areas in maroon are where we have some flash flood warnings. We have flash flood watches that extend from central New York all the way through southern New Hampshire, Vermont, and into Maine. We expect maybe another 1 to 3 inches. The major impacts from Fred are just about over with. We'll be done with it completely by tonight. Now, let's get to Henri, a tropical storm, 70-mile-per-hour winds. One of the keys to the forecast, a stronger Henri would be more likely to go towards New England. If this storm stays weaker over the next 2 days, it would be more likely to miss us just off the East Coast. So that'll be one thing to watch. A stronger storm would actually be worse for us. It would be closer to the New England. So this is the official forecast from the National Hurricane Center. That cone of uncertainty does include the coastal line of Maine, New Hampshire, eastern Massachusetts, including Boston, Rhode Island, and a portion of Long Island and Connecticut. And as far as our computer models go, we'll watch these very closely over the next couple of days. The black line on this map is the National Hurricane Center. All the other colors are our computer models that have just come in the last 6 to 8 hours. Notice almost all of them are closer to New England than the official forecast from the Hurricane Center. I expect at 11 a.m. when we get our next update, that shift a little bit closer to the New England coastline. So, yeah, something to definitely watch and pay attention to for your weekend plans in New England.
All right. We'll be keeping an eye on that for the next few days. Thank you, Bill.
Thanks, Bill.
Coming up, relief is pouring into Haiti with the U.S. Army now on the move to help.
But it's proving difficult in the country's more rural areas. We'll take you there next.
A daunting relief operation is ramping up in Haiti following that devastating earthquake. Americans are playing a key role in the effort, with teams racing against time to reach parts of the country that are still cut off. NBC News correspondent Gabe Gutierrez is there.
These are the first patients rescued from a village in the Haitian mountains days after the earthquake. This child clinging to an aid worker has a critical head injury.
One by one, they're brought off this chopper, patient after patient, over and over again. They're coming from some of the island's most remote regions that have had no access to medical care for days.
Help is pouring into Haiti, but with landslides cutting off rural roads, it's a nightmare to distribute supplies to those who need it most. Now, the U.S. Army is on the move, today rushing in aid from Samaritan's Purse into one of the hardest hit regions, a place where hospitals are desperately overcrowded and overwhelmed.
Why is it so important for you to be here?
It's very important. Nobody has been up to see these patients yet, and it's been, what, 5 days now? So this is why we do what we do.
Retired flight paramedic Teresa Gray flew in from Alaska, one of many American volunteers now scrambling to help.
It's always an urgent need when Haiti is in trouble. Always.
World Central Kitchen responded to the 2010 earthquake, the 2016 hurricane, and now...
So we're going to be here as long as we need to be.
The damage here is likely in the billions of dollars. The true cost might never be known. Gabe Gutierrez, NBC News, Port-au-Prince, Haiti.
Let's take a look at what else is making news around the world this morning.
Claudio Labanga is with us today from Rome. Good morning, Claudio.
Good morning, Savannah. Good morning, Joe. We're after a recent spike in COVID-19 cases in Israel. Now the authorities there are requiring anyone over the age of 3 to show a proof of vaccination before they enter any indoor public places. Now, Israel has been on the forefront of the global vaccination campaign, with almost 90% of the adult population now fully immunized. But the Delta variant has now led to a resurgence of the pandemic, as well as a tightening of the restrictions. And talking about coronavirus, well, the first COVID-19 case has been detected in the Tokyo Paralympic Village, just as it happened recently with the Olympics. The spectators are banned from the stadiums. They can't watch the games there. But at the same time, after the Olympics, there was a spike in coronavirus cases in the Tokyo area, with critics saying that it was partly due to the Olympics. And last but not least, local authorities in a rural town in Spain have reminded everyone, tourists and visitors in particular, that they can't do anything about the noises and smells of nature, of course. Well, now, after a number of visitors and tourists have complained about the braying donkeys or crowing roosters or even the ringing of church bells, they have set up a tongue-in-cheek poster campaign in which they said that those who visit their rural town should accept all the risks of nature. Guys.
Beware of cows and ringing church bells.
Yeah.
All right.
Kind of nature.
Thank you, Claudio.
Very dangerous.
All right. Coming up, discrimination at the doctor's office.
Yes, that's right. We'll take a closer look at the shocking treatment many trans Americans face when seeking health care. That's up next. Welcome back to the Good Talker. Disney World and Disneyland have announced they are ditching their FastPass reservation system. This fall, the resorts will introduce a new planning tool called Disney Genie. The biggest difference in the services, our guests will no longer be able to get shorter line access for the price of admission. That's now going to cost an additional $15. The free planning tool, Disney Genie, will allow guests to join a virtual queue to wait online, but it won't help you cut. I used to be a FastPass wizard. You know, you'd go in, you knew which ones to get when and when you were going to return and have a whole plan. So I don't know.
It's definitely a strategy, and you could only do so many at a time, right?
Right.
That's sort of the thing.
Yeah, you can only do so many. I know. And I wonder, a digital line is kind of interesting. I wonder what that means. You don't have to be there. You could be in line for another one. I don't know.
We'll find out. All right. Thank you, Savannah. A new report says medical mistreatment is keeping some transgender Americans from receiving health care, and sometimes it keeps them from even seeking it. The Center for American Progress, a liberal think tank, surveyed more than 1,500 trans adults, found that nearly half, 47%, said they experienced mistreatment at the hands of a medical provider in the previous year. That includes refusal of care, even verbal or physical abuse, and that number jumps to 68% for trans people of color. NBC Out reporter Joe Yerkeba joins us now to break down their latest reporting. Joe, good morning to you. Let's talk about these numbers and these experiences. What are trans people facing when they search for health care?
Good morning. Sure. You can take a look at this graphic we have of some of the data. The survey found that 32% of trans respondents said a doctor intentionally misgendered them, meaning they used the wrong pronouns or used the wrong name. 25% said that a doctor refused to give health care related to gender transition. 20% said a doctor was physically rough or abusive when treating them, and 18% said a doctor refused to see them entirely. And all of those numbers were higher for trans respondents of color.
Joe, this conversation isn't just about searching for gender-affirming care. It's really about all health care, emergency rooms and beyond. I know you spoke with one trans person about their experiences with discrimination. What did they tell you?
Yes, so one trans non-binary person I spoke with, Jesse Brace, said staff in an emergency room near their home in Lawrence, Kansas, refused to acknowledge their chosen name and their pronouns and didn't treat them for what they went in for. And as a result, they were homeless for more than 3 years and went without care for their seizures. They lost their job and ended up living either out of their car or on the streets for the next 3 years.
That's just hard to hear, living in your car for 3 years because you don't get the care that you need. Joe, can you tell us about the people who are fighting against this discrimination, working to try and get health care, better health care, really, to trans people in need?
Sure. Yeah, we have a photo you can see here of the staff in Trans Health Northampton in Massachusetts. It's an independent clinic that is founded and run entirely by transgender medical providers. And Trans Health provides holistic care that really centers the patient's goals, whether that's transition or just regular preventive care. And these kinds of initiatives are really starting up across the country.
And we talked to Dallas Ducar, who's part of that organization, for our Trans America special earlier this year. Really a lot of great work being done there. Joe Yerkeba, Joe, thank you so much.
Singer-songwriter Bob Dylan is being sued in New York State for allegedly drugging and sexually abusing a 12-year-old girl back in 1965. NBC News legal analyst Danny Ceballos takes a look at the case and the now expired New York law that made the suit possible.
Bob Dylan is being sued in New York State court by a woman who claims the singer-songwriter sexually abused her when she was 12 years old in 1965. This lawsuit was one of an avalanche of lawsuits that were filed last week in New York State court, under the Child Victims Act. Without the act, none of the allegations against Bob Dylan could have been brought today because all the relevant statutes of limitations would have expired. The plaintiff in the Bob Dylan case alleges that the abuse occurred at Dylan's residence at the time in New York's Chelsea Hotel. The accuser is now 68 and lives in Connecticut, but she's identified only by her initials. Bob Dylan's spokesperson has said this 56-year-old claim is untrue, and they say they're going to vigorously defend him. The reason so many of these lawsuits were filed just last week is that last Saturday was the deadline under the Child Victims Act. Governor Cuomo signed a law that opened a temporary window suspending statutes of limitations in civil cases. During this time period, anyone could sue any other person or company or the government alleging certain forms of sexual abuse, no matter how long ago the allegations happened. But a recurring theme in a lot of these complaints is that absence of evidence. In some situations, it's been just so long, it could be difficult to piece together a narrative in court in some cases. So we'll see what evidence the plaintiff brings to court in the Bob Dylan case.
Coming up, the cost of childcare is unsurprisingly on the rise in this pandemic age.
Yeah, we'll tell you about the labor shortage crisis the industry is now facing and what this could mean for your family up next. As more parents return to the workplace, many are finding that childcare has become more scarce and very expensive.
NBC's Stephanie Rule takes a look at the problem in our series, The Future of Work.
Hey there, Joe and Savannah. As more and more parents are returning to the workplace, they're shocked to realize that the cost of childcare has gotten a lot more expensive. And that's if you can find it. With so many childcare centers being forced to close in the last year, it's tough to even get a spot.
For working mom Portia Twitt, daycare is essential, but she can't afford full-time care.
My childcare costs more than my mortgage.
Tuition for her 2-year-old's care up 30%.
I am trying to find if I can do a combination of daycare at a different location, hiring in-person care, and starting my day much earlier to watch her. It's actually horrific.
For the 27 million Americans who need childcare in order to work, it's a hefty expense. For young children, averaging $250 per week or $13,000 a year. That cost could rise as 4 out of every 5 childcare centers say they don't have enough staff, and some are paying more to hire workers.
The biggest challenge right now is finding and retaining high-quality staff.
During the pandemic, more than a third of workers lost their jobs, and some never returned to childcare centers that pay around $12 an hour.
Childcare facilities are now having to compete with higher wages offered by a lot of large multinational corporations who are also facing worker shortages.
Rose Cushing oversees 11 childcare centers in New Jersey.
We had to close a number of our programs and we had to close a number of our rooms.
How come?
Because we don't have enough staff at this time. We're down about 50 staff in early childhood ed.
To find workers, she's increased starting pay by $2 an hour. Until she has more staff, her waiting list of nearly 40 families will likely grow.
If you're down a clerk at your local convenience store, the line would be longer, the service would be slower. That's not an option in childcare.
The federal government has provided over $53 billion in COVID relief for childcare and early education. And President Biden wants $450 billion as part of his Build Back Better agenda. It includes capping childcare costs for families, investing in childcare centers, and raising the minimum wage for workers to $15 an hour.
Are you able to do your best at work?
I don't think so. You get that stereotypical mom guilt of where you're like, I'm not being the best employee, I'm not being the best mom, and it hurts your heart.
A growing problem with no easy solution.
Rose Cushing, who directs those child care centers in New Jersey, says this problem is only going to get worse if she cannot hire more staff. She'd be able to serve a lot more people if she could hire that staff back. And as it stands, if the government doesn't step in with more support or companies take a more aggressive role, this problem is going to persist, and it won't just keep parents from returning to work full-time. It's going to keep kids from being able to develop and get ready for full-time school.
Coming up, monthly child tax credits are now hitting bank accounts, but some parents are still confused over whether they're eligible.
Up next, we'll bring you one mother's fight for relief. Many of us are eager to travel again, but a group of veterans has been waiting 16 months for one truly special trip. NBC Nightly News anchor Lester Holt has their story.
Joe and Savannah, it was all about honoring those who served. The special flight that brought American war veterans to Washington for the first time since the pandemic.
So it looked like it was going to be a fun day. I got up at 1 o'clock to come out here.
Their journey started in Chicago. 112 veterans boarded a chartered flight to Washington, D.C., where they spent the day. This moment, almost 16 months in the making. The first honor flight since the pandemic. And today, 3 veterans from World War II, 33 from the Korean War, and 76 from the Vietnam War were recognized.
Thank you for your service, Bill.
Oh, thank you. Curtis Bentley, who served in the Navy during World War II, joined today's flight.
I'd been here before and I never seen this, and I'm just real thrilled to be here today.
Bentley and the other 111 vets visited the World War II, Lincoln, Korean, and Vietnam memorials.
It was a real honor. I'll never forget this. Never.
But for some of them, it was more about meeting other veterans and sharing stories.
There's actually a healing effect with them getting together with their fellow veterans that have experienced the same situations.
Heroes returning home tonight after seeing the memorials built in their honor for their sacrifice and for our freedom.
A recent survey found many parents don't know whether they're eligible to receive the child tax credit. As you can imagine, that's keeping many families from gaining access to potentially life-changing money. Here's NBC News Now anchor Aaron Gilchrist with more on one mother's story.
The expanded child tax credit is being called a measure that could potentially cut child poverty nearly in half. 2 rounds of these checks have already hit bank accounts, but millions of the country's poorest children have yet to see a dime. Melinda Williams is a married mother of 5 living in Queens. She grew up in the Queensbridge community and became a member of this congregation at just 13 years old.
Bishop Taylor was on the corner, Pastor Taylor at the time, preaching. I was outside with my friends Friday night, and I heard the offer of salvation and had the decision of my life to make.
After graduating from high school, Melinda moved to South Carolina for college and eventually settled down with her family. But in 2014, she fell on some pretty tough times.
I had what's called a subarachnoid hemorrhage, which is a severe type of stroke. I couldn't walk, couldn't hold the newborn or anything. And my husband ended up in hospital. We ended up going through a natural disaster. We lost the home that we built. We ended up back in New York.
Here in New York, things weren't much easier, but Melinda managed to reconnect with a community that she knew her family could rely on.
We were homeless, and we applied for disability, Social Security, and doors just started opening up.
The person who'd altered the course of her life 20 years ago was now here to do it again.
A few weeks ago, Bishop called me and said, "Have I heard of the child tax credit?" And I said, yes, but I don't think I qualify because I didn't file taxes.
Melinda and her family, like so many others, aren't required to file income taxes because they don't make enough money. The expansion of the child tax credit made it so that even those who don't earn income can qualify. But because the Williams family hasn't filed a return in the last few years, they don't exist in the eyes of the IRS. Ultimately, they weren't automatically enrolled like most families. The IRS is the agency tasked with doling out this money, but getting it in the hands of low-income families has proven difficult. In communities like Melinda's, churches and local organizations are now having to pick up the slack.
It's our job to amplify the message to those that don't know.
It feels good to be together again.
Bishop Mitchell G. Taylor is the senior pastor for the Center of Hope International. He's also the co-founder of Urban Upbound, a local nonprofit that focuses on lifting members of the community out of poverty. Here they teach financial wellness, offer free tax preparation, and provide employment services.
We realized that one church couldn't solve the mammoth issues that existed in public housing neighborhoods. And that's why it was important that we start a non-sectarian organization separate from the Center of Hope that could really address the mammoth needs that exist in public housing neighborhoods.
Because of Urban Upbound, Melinda was able to file her taxes the next day and realized she had almost left tens of thousands of dollars on the table.
Not only did I qualify, did we qualify for the child tax credit, we also were owed taxes that we didn't know about.
Already, the effects of the child tax credit are being felt nationwide. A recent survey by the Census Bureau found parents reported less trouble affording food and paying for household expenses after the first payments were sent out on July 15th. For Melinda and her family, the child tax credit provides an overwhelming sense of relief and gratitude.
I have lived to see a lot of prejudice. Some people believe that you're getting a handout or something. So now to have people say sometimes people are going through things that's not at fault of their own. I get from this that there are people in places that stands up and fights for just justice.
But for so many others, unaware they qualify or otherwise unable to sign up, relief is still a long way away.
That does it for this hour of Morning News Now.
But the news continues right now.